WAJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 5 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
And good morning. It is Wellness Wednesday, and we're glad you're with us on WAJR and the AJR News Network, program sponsored by Fairmont Regional Medical Center. And our special guest this morning is Ricilyn Aston, and she's a nurse specializing in ostomy. Did I say that right? Did I get that right?
Yes, you got that right.
All right, well, define that for us. Let's start there, the very basics of what you do.
Okay, an ostomy nurse is somebody that takes care of a patient that has an ostomy, such as when the bowel is out onto the abdomen, or even like a urostomy when the ureters are out. There's different types of ostomies out there, and there's lots of complications that can occur when you have a part of your bowel that's out onto your abdomen. Mm-hmm. So when patients, even 20 years out with their ostomy surgeries or whatever, if they have skin complications, if they have troubles finding an appliance to fit over their ostomy, they can come to the wound center and consult with me, and we can try to bump our heads together to try to figure out a solution, try to get rid of the skin irritation, try to find a system that will work for them. So it's I know when somebody has an ostomy, it's frustrating. They feel like they're all by themselves. Mm-hmm. So it's good to have a place or somebody that they can come to and kind of work things out.
Okay, the wound healing program at Fairmont Regional Medical Center, you can reach them at 363-4698. And you're a longtime healthcare professional, but fairly new to this part of it?
I think I've been in wound care since 2012, maybe. That was what I called my midlife crisis. I'd been a cardiac nurse for years, and I just needed a change. So I went and got my wound ostomy continence certification, got educated, and I'm still learning every day, though, because the wound world, the ostomy world, is you're just always learning new things, new tricks.
Every case is different.
New ideas. Yeah, and everybody's different. But I still get to see my same kinds of patients. I still get to see my cardiac patients, my diabetic patients. Mm-hmm. So I still feel like I can use my skills and my knowledge in the wound world.
Why do some people have a difficult time with their wounds healing? What are the different factors there?
Well, a lot of times it's the comorbidities. I mean, people that are diabetic, people that have have problems with their circulation, people that aren't able to move around and have problems with pressure. They just have more complications if you're not able to eat properly, if you're not able to move. There's just different things, and it's better for them to come to a wound center where we can keep tabs on them, change up their regimens or whatever, help advise them on nutrition, on how to offload their wounds. And then if they become infected or have something, we can help treat that as well.
Yeah, diet and nutrition are important in every aspect, but when you've got an open wound, and you've got a wound that won't heal, that's especially important, isn't it?
Yes, it is, because a lot of times people are down in their proteins, and we can help advise them in better ways to increase their protein intake. Sometimes patients are diabetic, or they have renal failure, so it gets a little more difficult, and in situations like that we might have to reach out to other people like dietitians and people like that to try to counsel them on how to eat properly for their wounds.
Do you deal only with ostomy type situations, or are there other wounds, accidents, that type of thing?
Right. The wound center, I mean, the ostomy, my part is kind of new. In the last 3 years or so, you can actually come to the wound center and I can counsel you on your ostomy and things like that, since I'm certified. But for the most part, the wound center, I mean, we see diabetic wounds, we see pressure ulcers, we see traumatic wounds that just won't heal. Mm-hmm. We see surgical wounds that have healed and then reopened for some unforeseen reason. And then we have the hyperbaric chambers also. So we have 2 hyperbaric chambers. So people that have the what we call chronic osteomyelitis or diabetic foot ulcers, we can work them up for the hyperbarics also.
Okay, I want to get into that in a little bit because that's a big part of what you do, and I want you to define the hyperbaric therapy and what that's all about. But you talked about infection, and I guess that's the worst case scenario when somebody develops an infection, because you got to identify what type, right, and then you have to treat it.
Correct. Yeah, and that's the thing, because all wounds have bacteria in them, but whenever your wounds, the healing process slows, then we need to culture it. We need to find out if something's overgrowing in that wound to prevent it from healing. And that's why when people follow with us properly and stuff, we can keep tabs on that. We can get them on the right antibiotics to help fight that bacteria that's deterring their healing process.
Is there such thing as good bacteria in that wound to help, or how does that work?
No, no, it's not like the bowel where there's good bacteria in the bowel. But because the wound's open, there is bacteria there. It's just we want to try to scrape the wound, keep it bleeding, keep that bacteria that wants to form, keep it from overgrowing. Because when it grows and gets like a layer over that wound, then the wound's not able to heal.
So there's no such thing as a good bacteria. Some bacteria are worse than others.
Exactly. That would be a good way to put it.
Let's talk about the hyperbaric oxygen therapy. Now, when I was exposed to this, the hyperbaric chamber, that type of thing, my background is is athletes. It helps them build their wind and their endurance. But this obviously is geared towards wound healing and wound therapy. Talk about what exactly that is and what it does.
Okay. Now, they have not sent me to hyperbaric training yet, so I will tell you from my wound education and from just being subjected to certain things. I know that patients that have had radiation wounds, they've received radiation and then they've got wounds that happen because of that, that the hyperbaric oxygen, the high pressure oxygen, can help those types of wounds heal. I know that diabetic patients that end up with chronic osteomyelitis because they've got bone exposed in their wounds, that kind of oxygen under pressure can help, has been shown to help those patients with those kinds of wounds, and hopefully help prevent them from losing their foot or their limb. There's arterial wounds where patients just don't have that once they get their arterial flow fixed and stuff, that we could use hyperbaric oxygen for those types of wounds. That's my basic knowledge. I know that the studies show that hyperbaric oxygen can help, and we definitely want to add it to the regimen to help prevent people from losing their limbs.
Right.
So,
how common are radiation wounds for people that are undergoing cancer treatment?
I know that, well, I can't tell you numbers and statistics. I know that radiation is harsh, and I know that there's times that people end up with radiation burns that we don't see. I mean, they end up with burns in their throat, with problems, like when people that have it for their, like prostate and stuff, they end up with cystitis and things like that.
Internal.
Yeah, so we don't necessarily see that. So, but there are patients that have had like radiation burns on their chest and stuff like that that could benefit from us.
Okay. We are with Ricilyn Aston. She's an ostomy nurse, of course, Fairmont Regional Medical Center, part of the wound healing program, and you can reach them, make an appointment, get a consultation, 363-4698. That's the number to call. Before we take a break here, dressing of a wound. I mean, again, every case is different, isn't it?
Yes, every case is different. You want to, depending on how much drainage, what the base of the wound looks like, tells us what kind of a dressing you need. If you need certain medication to try to, to help work the wound down to a nice beefy red look. Sometimes patients' wounds are, are very productive. They have a lot of discharge and stuff. So in those types of wounds, you want to keep the drainage, to where it doesn't macerate or make the skin around the wound wet. Some wounds are dry, and you need to try to make them moist. So, and they go through different stages. So dressings are a big deal, and it's better to have somebody help you out with those.
And more times than not, you're dealing with people that are in pain. I mean, because these things that you've described all sound very painful. So you have to be be cognizant of that.
Exactly, because there are some dressings that are non-adherent. There are some dressings that you can moisten and kind of work them off easily. There are some wounds that are very painful, and you have to address those issues with your dressing choices also.
296-0041, that's the number to call if you have a question about any of this. And again, you can reach the wound healing program at Fairmont Regional Medical Center at 363-4698. We are with Ricilyn Aston. She's a wound care expert, ostomy nurse at Fairmont Regional Medical Center, and we'll take a break. We'll continue the conversation after this.
Now back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
Program this morning, Wellness Wednesday, focusing on wound care. And Fairmont Regional Medical Center, the wound healing program, 363-4698. That's the number to call if you'd like more information. We're visiting with Ricilyn Aston, a ostomy nurse at Fairmont Regional Medical Center, and has vast knowledge of wounds and wound care. And we've talked about the hyperbaric oxygen therapy. We've talked about the different dressings for wounds, and obviously how every wound is different, every person is different. Wound debridement. Did I say that right?
Debridement.
Okay.
I say debridement, but it might be because I'm from up north. I don't know.
Define that. What are we talking about?
Debridement, there's different types of debridement. You can debride with medication or with dressing choices. Debridement at the wound center, we like it when our physicians take a curette or take scissors and kind of scrape the wound to get down to where the wound bleeds a little bit, because that reminds the body that it has a wound and it tells it to try to heal it. Because if not, then the body just thinks that the wound has a covering when that it's healed, so it needs stimulated. Some wounds have to go to surgery because they're too painful to debride in the wound center, and we have surgeons that will take them to the operating room, and it's a same-day procedure, so they get to leave that day, and they'll do a surgical debridement if it's too painful in the office.
All right, wound debridement. Again, every case is different. That's one of the things that you have to evaluate. Doppler evaluation. This sounds high-tech. This sounds something that's fairly new.
No, Dopplers have been out there for a long time, and they're non-invasive. Patients that have wounds on their feet or their legs, we want to make sure they have enough blood flow to heal that wound, because if they don't have enough circulation to the wound's not going to heal. So we do what we call a blood pressure test. Well, we send them up on the hill to have it done, but it's where they put blood pressures on cuffs on your leg, and they compare the pressures in the different areas of your leg to the pressure on your arm. And if there is a significant change, if it's less than 70%, then we'll want to maybe get you hooked up with somebody that can put a stent or something to get better blood flow so that wound can heal.
So that's a non-invasive way to kind of gauge the blood flow.
Correct.
And this is going to sound like an extremely obvious question, but how important is good blood flow to the healing of wounds?
Well, it's essential. Yeah, because that's how you're gonna get your nutrients to that wound. That's how you're gonna get that wound bed to grow skin across it, is by having the blood to flow there to help grow the skin.
All right, so you need good nutrients in your blood. You need good blood flow
exactly
to get the healing agents to the wound. All right, there's another word on here that I'm reluctant to try. Starts with a T. oxygen monitoring,
transcutaneous?
Yes.
Yeah, transcutaneous oxygen monitoring.
Transcutaneous oxygen monitoring.
Yeah.
All right, I got it.
No, we have a TCOM machine. I must say we don't use it as often as we probably could, but it lets us know kind of how much blood's flowing to that wound also. I don't know that it's as reliable, so we're more apt to send you up for the Doppler studies.
Yeah.
But yeah, there is a TCOM system that you can use, but it's
TCOM, I like that better.
yeah, it's
That's easier to say. Exactly. Well, we've learned a lot, and obviously we encourage you if you have issues in this regard. And what's the most common? Are diabetic type wounds? Is that the most common that you see?
In my opinion, diabetic ulcers and venous stasis ulcers are the most common. It just seems like there's a lot of people that have poor blood return back to the heart. So they end up with their legs swelling, and then they get the sores on their legs. And then because of the swelling, they don't want to heal over, and then the fluid leaks out because that's, the least resistant place. So if we can get those patients in and get their circulation checked out and help get them on a regimen where they've got some compression on those lower legs, we can usually get them healed up. Diabetic wounds, yeah, diabetes is a terrible, terrible disease. And diabetic wounds are really tough to deal with because they can't feel their feet.
Right.
They can't feel their wound. They don't know what's happening. So, yeah, and then with their blood sugars running high and different things. So it's a multifactorial problem whenever it comes to diabetic ulcers.
You just don't feel well, and then you've got a wound to deal with.
Right.
What would you, if you could give a pep talk to somebody out there who's dealing with some of this and they're a little bit apprehensive, they're afraid, they think it's going to hurt, they think there's no help for them, what would you say to encourage them to give your wound healing center a call and come in and get checked out?
Well, I would just say that it's a lot easier and a lot better to deal with your wound if you've got somebody to talk to about it, if you've got somebody that's constantly looking out after it. We try our best to help alleviate any pain. If things are too painful, we'll stop. But it's better for them to come see us so that we can do what's best for that wound for that time. And wounds change, dressings change, and it's just, I just would think that it would be less stressful for them if they had somebody that was alongside them helping them out.
Don't put it off. The sooner the better. Things only get worse, right?
Right. And we're able to offer, like, if they need home health, if they need other assistance and stuff like that, we can kind of get them set up with people in their community.
So the support is there, the expertise is there.
Yes.
So we encourage everybody to give them a call. The Wound Healing Program at Fairmont Regional Medical Center, 363-4698. That's the number to call. And Ricilyn Aston has been our guest. We appreciate your time. Again, it's been very informative, and I think we've learned a lot.
Thank you.
And obviously, you've kind of fallen in love with the Fairmont region, haven't you? Talk about that a little bit.
Well, it's what I came here as a traveler back in the day, and I just love it. I mean, the terrain's beautiful. The hospital, I just love Fairmont Regional Medical Center. And I've always loved my cardiac patients, but now that I'm at the wound center, I still get to see them. I still get to touch base with their heart problems or their diabetic issues. I still get to counsel them, but I get to see them in a little I don't want to say better, but I mean, they're not on death's door. When I see them at the wound center, I can actually talk to them and converse with them and find out about their family and stuff like that. Yeah, and help them. Yes. Right. Yes, definitely.
Very good. Well, again, been very informative. We appreciate your time and making the effort to come in. Again, the Wound Healing, 363-4698, Fairmont Regional Medical Center, a sponsor of this program, Wellness Wednesday on WAJR and the AJR News Network. Nurse Aston, thanks.
Thank you very much.
We hope you'll join us again in a couple of weeks for the next edition of Wellness Wednesday, sponsored by Fairmont Regional Medical Center.